Everyone, thank you so much. These are called our timely topic series that we're doing. So we started with unvaccinated children in school, and now we're doing pregnancy and COVID-19, and hopefully we're going to have more and more to follow. So tonight we have Drs. Mazoon and Dr. McConnell. Dr. Melanie Mazoon is a managing physician for immunization practices, so that's very timely for tonight, and pediatric hospitalist here at Kelsey-Seybold. She works at our main campus. And we also have Dr. Daniela McConnell. She's an OBGYN and joined Kelsey here at 2019. And she practices at our Cypress and the Vintage clinics. Julie Pipert is a part of our Kelsey's digital and marketing team. She has been a huge part of organizing this webinar tonight, and she will be moderating tonight's discussion. So I think we're ready to start if you are, Julie. Oh,
Definitely.
The chat is open as well. Sorry, I forgot to mention that. The chat is open that you can submit any questions, and I'll be looking at that and sending those to Julie, and we'll try to get to every question, but I promise you will walk away learning something tonight.
Yes, please feel free to send your questions in. I know that we are happy to answer what your concerns and questions are. So let's start with something that we promised when you signed up for this. And this was the main question on everyone's mind. And I'm going to direct this to both doctors. And that is, when should I get my vaccine if I am pregnant? Dr. McConnell, do you want to start? And then Dr. Mazoon, do you want to follow? Thank you.
I would say, anytime is a good time to get the vaccine. The vaccine will not hurt your baby. As far as everything that we've seen, we've had since January, we've had pregnant women getting vaccinated. We haven't seen any issues with the newborns. We haven't seen any issues while pregnant. We can't say that we have much data for years down the line, but we can say that this is as safe as the flu vaccine, as the Tdap vaccine, from what we know and how the vaccine was created. We do know that getting a fever in the first trimester can cause birth defects. And so, if you get a really bad reaction from anything, whether it's getting the cold or the flu or COVID and getting a severe fever, you could have a fetal malformation in the first trimester. Even if you were to take a really hot bath in a bathtub more than 100 degrees Fahrenheit, you could have a fetal malformation. And so with the COVID vaccine, if you were to get a fever, that could be a concern, but we're not really seeing fevers with the vaccine itself. So really anytime in pregnancy, it is safe. Even postpartum, if you've already had your baby and you're breastfeeding, it is safe. We're creating antibodies. The vaccine isn't really, the vector that is formed has a little spiky protein on it that tells your body, hey, this is what you need to react against. You need to attack this little spike. And then your body makes antibodies to attack that spike. And then the vector actually dissolves within days. So it doesn't stay in your body for a very long time. All you have left after days, after getting the vaccine, is just the antibody that your own body makes against that little spike. And then those antibodies replicate. And so the antibodies are what are protecting you against getting COVID. Or if you get COVID, then your disease is less severe. And then you're less likely to get the fever and have to have hospitalization and intubation. So we tell every patient that any time in pregnancy is a good time. Obviously, if you're able to get it before pregnancy, that's great too.
Even better. And Dr. Mazoon, I know you have some thoughts about this.
Yeah, so I'm kind of an old person, and years ago we used to worry about vaccination in pregnancy. We used to tell people to wait for the flu vaccine until they were past the first trimester. We still worry about certain vaccines that are live virus vaccines in pregnancy because those vaccines, the virus does replicate in your system for a while. But in fact, really, even those live virus vaccines have never been shown to cause serious fetal malformations. And we've been giving vaccines in the first trimester for flu and for Tdap for a long time now, actually, more than a decade and a half, and really no adverse consequences. We know that miscarriages happen most often in the first trimester, and I think that the medical community for a while was afraid of recommending vaccines in the first trimester, not only because they didn't want to cause fever, but also because they didn't want to have the vaccine be blamed for a miscarriage it didn't cause. And so you may have a physician who's got a little trepidation until you get into the second trimester about vaccinating you. In point of fact, your body is reacting to foreign invaders 24/7 and makes antibodies to all kinds of things all the time. You are daily exposed to germs that you may not have in your own system, and your body knows how to protect you, how to recognize foreign proteins, and how to develop immunity. And this is just an intentional exposure to a foreign protein that you can develop immunity to, so that when the real virus comes along, you'll be protected. So I would not worry about getting the vaccine even in the first trimester. We don't recommend that you take medication to reduce fever at the same time you get the vaccine. But if the day you get the vaccine, that evening, you start to feel achy or have a little low-grade fever, it's perfectly fine to take some ibuprofen or Tylenol, and that should be all you really need.
Great. We do have our first question from a participant. Thank you very much. The rest of you, please continue to send in your questions. This one is, I am in my 35th week and was vaccinated in March. Can I get my booster before I give birth to give my baby an extra dose of immunity? Dr. McConnell, what's your advice to this person?
Yes, you can get your booster. I don't know if they're giving them out yet at Kelsey though. I know at Methodist, today was the first day that they started giving them. I actually got vaccinated today. But yes, it would be safe to do so.
Great, thank you.
And we are giving them at Kelsey starting today as well.
Yes. And Kelsey patients just recently received an email with some information about the booster. So keep checking your email. We like to make sure that we send good information to you via our email system.
I would like to comment just a little further on that. So the boosters are recommended for sure for people 65 and up, and people who have underlying health conditions 18 to 50 are in the may take the vaccine. So most pregnant women fall in that category. So if you are, considering it but not sure, I would have you talk to your OB-GYN, about what your risk factors are, because you might have more than one risk factor. You might have pregnancy and obesity and diabetes. And so those risk factors do kind of add up. Yeah. 2 doses of vaccine are very protective against severe illness and death, but pregnancy is a particular risk factor. So don't think that just because you're young and healthy that you don't have any risk factors. If you're pregnant, you do have a risk factor, and you may have more than one. So the booster, you will qualify for the booster.
Absolutely.
Great. We've got a few more questions coming in, so let me get this. This question is, I thought it was not recommended to take any medications prophylactically to prevent any side effects, headaches, fevers, and to wait at least 4 hours after the vaccine. Is that correct? Dr. Mazoon, can you start with that, please?
Yes, that is correct. So we don't want you to take anything until you develop some side effects, because there's been some studies in children that if they're given Tylenol or ibuprofen prior to vaccination to try and prevent side effects, they actually develop less immunity. And so fever and that headache and the I don't feel well, that's all actually a symptom of your body responding, your immune system responding to the vaccine. And we want that response. We don't want it to be overwhelmingly severe or make you miserable for days. So we want you to get a little bit of that response before you start medicating yourself. And so 4 hours later or so, you'd be fine to take it, but don't take it on the way in to get your shot.
And, all we've got right now is anecdotes, more or less, because the booster is so new. But have either of you heard any anecdotes to help people understand what they might expect with the booster. Would they have a similar response to that as they did to the vaccination? Should they try to prepare to take it easy the next day, or do you have any suggestions or information?
Most people are having about the same response to the third dose or the booster dose as they did to their second dose. So that includes people who are getting a third dose because they're immune compromised and not waiting that 6-month period. They're just getting a third dose of their primary series. And that also includes people who have had a booster dose. They're having about the same reaction they had the second time around. The second time around, that reaction is a little more marked than the first reaction. So it might be wise to take it on a Friday so you don't have to work the next day, or to plan to have a day off, but you don't necessarily have to.
Great. Dr. McConnell, have you got anything to add to that, or should we move to the
I got it today, and my second shot was pretty, I had really bad back pain for some reason. That's how it affected me. Maybe I got a little dizzy around dinner time. But I got it today at 8 a.m. and my arm hurts, and that's all. So I have a little bit of a headache. Nothing as bad as the second one yet. So we'll see.
Great, thank you. So we've got two questions, and I'm going to combine them into one because I think it's something that a lot of people are wondering, particularly if they're making decisions not just for their body, but for their baby as well at the same time. And that is, there were 3 approved vaccines out, and some people got J&J, some got Pfizer, some got Moderna. So the question is, for those who didn't get Pfizer the first go around, they got one of the other ones. Can they get a booster? And is it safe to mix the 2 different vaccines?
I'll answer that. So
Okay.
at this point, we don't recommend that they intentionally mix the 2 or 3 different types of vaccine. And that's because what's been studied is the single vaccine per recipient, right? Nobody does a study on people who've crossed over because it would be hard to collect people who did it all in the same way. And so we know that 2 or 3 doses of the Pfizer will boost your immunity and give you a certain level of protection. The Moderna and the J&J vaccines also will likely have boosters recommended within the month, actually. And so remember that the Pfizer vaccine is the first one who came out. So the Moderna and J&J recipients actually are not, most of them are not 6 months out from their vaccine receipt. And so they're not actually eligible for a booster just yet anyway. And by the time they're eligible, the boosters will be there. Also remember that boosters are not an emergency. That first dose and that second dose, those were really critical to get people's immunity up. Your immunity is still good. The booster is basically, ramping it up a little bit, but your immunity is still protecting you from serious illness and hospitalization. And so you don't have to rush in to get it. It's worth it to wait to get the same type of vaccine you got the first time around. All 3 vaccines are really effective and well worth taking. And I wouldn't worry that, I had a side effect from one, so I'm going to take a different one. I wouldn't do any mixing without discussing it with your physician. There might be rare instances where you might want to do that, but by and large, people should get the same brand that they got the first time around.
Good, thank you very much. And that actually caught a couple of different questions about timelines. So that was very helpful. Thank you. Dr. McConnell, this person is curious. She is unvaccinated and just recovered from COVID, 16 weeks pregnant. When can she get vaccinated, or does she need to get vaccinated? And this is probably quite a few people with this question. You're muted, Dr. McConnell. I'm sorry.
Yeah, this is a really common question I get in clinic all the time. So usually what we say, what the studies have shown is that getting COVID is equivalent to getting 1 shot, one of the 2 vaccines. So, or I guess, I don't know, with the Janssen, I guess it'd be like half a vaccine. I don't know about that. But so we do recommend you still get vaccinated. We recommend you wait 4 weeks before getting vaccinated, especially if you get the monoclonal antibodies when you do get COVID. That's what the recommendation is right now.
Okay, great.
Actually,
Thank
if
you.
you get the monoclonal antibodies, you really should wait 90 days. And
Oh,
so,
right. It's
or
90
like
days.
3 months. So, and the reason to wait after you've had COVID is partially to protect the vaccinated, the vaccinators, because we don't want you to come into the clinic still spreading COVID virus in order to get your vaccine. So if there's some reason you need it really urgently, you could do it before 4 weeks, but Dr. McConnell's advice is good that waiting about a month is a good, reasonable thing to do. Most of the time, we'd still recommend you go ahead and get 2 doses instead of one, but you're probably better protected with that 1 dose than people who haven't had COVID who get 1 dose.
So the recommendation is definitely after the appropriate time period and discuss that with your doctor, do go ahead and get the vaccine.
Yes.
Okay, great. Thank you. Um, this taps back a little bit to something you were discussing previously, and that is, are all pregnant women recommended to get the booster, or just certain pregnant women with underlying health conditions? And Dr. Mazoon, just to reiterate, you said being pregnant is a health condition.
That is a risk factor. Pregnant women are at high risk of being admitted to the intensive care unit with flu and with COVID. These respiratory illnesses are particularly bad in pregnancy because, as you probably know, if you're 35 weeks pregnant, it's hard to breathe already with a big abdomen that's full of baby. And your immune system is affected by pregnancy, so you're less able to fight it off. And so it is a risk factor. It's not one that's being specifically called out in the general media campaigns about getting the booster, but it is a risk factor.
Right. So when you're pregnant, you are considered immunocompromised because you want to think about your body. It kind of it shuts down your immune system so that it doesn't attack your baby because your baby is considered a foreign object. So anytime you're pregnant, you are considered immunocompromised. So you're in that category.
Great, thank you very much. And so that's the follow-up to that. And we touched on this briefly earlier, but just to make sure that those who may be joined in after the beginning of this, there were questions about, is there any data on pregnant women for the booster? So if you don't mind reiterating a little bit on that, so people can understand what we do know.
So what we know is that 2 doses are safe, and there haven't been enough pregnant women to get a 3rd dose to really have data. But pregnant women who choose to get a 3rd dose should actually enroll in the V-Safe. So that's a telephone messaging program where you can message basically the CDC if you're having any kind of issues that you think may be related to the vaccine. We do know that in the population in general that the 3rd dose is no more difficult for their body to handle than the 2nd dose. And so that shouldn't change because of pregnancy. That should be just the same. And we do know that this vaccine is not, it's not possible for this vaccine to I don't know, travel and do horrible things to your body or to your fetus anyway. It stays in your arm. It works in the immune tissues in your arm, and your lymph node in that area may swell because the vaccine is working primarily there. The antibodies that are produced do travel throughout your system, but those are protective antibodies like all the other antibodies in your system. So they're not likely to cause any problems. So actually, ACOG, the American College of OB-GYNs, and the Perinatologist Society, and a number of organizations who deal with pregnant women and pregnant women at high risk, early on in this pandemic made a very remarkable statement. They said it was time for us to stop considering pregnant women as a special population at high risk from medications and from vaccines, that we need to consider them at high risk of illness, and that medications and vaccines need to be offered to pregnant women to protect them. For too long, we've been sort of putting them on a pedestal and saying, okay, they can't have anything, because it all might hurt the baby. And in point of fact, there are very few medications that will affect the baby ill. And also with lactating women, there are very few medications that actually will get into breast milk and cause any problems with the baby. So, there are a few, and we know about those few, but vaccines are not among those.
Dr. McConnell, we've got definitely one question, but probably a lot of people curious about this, and that is, does the COVID vaccine pass immunity to the baby? And if so, for how long?
So we do know that the COVID vaccine does pass immunity to the baby. We've had lots of babies born after the mom had the COVID vaccine, and we're actually seeing antibodies in the baby. We're also seeing antibodies in babies after breastfeeding. So we definitely know that the antibodies are passed. As to how long, I don't know. I'm assuming as long as it is for us, but I don't know that there's any data on that. Do you, Dr. Mazoon?
So the only data that we know about how long placentally acquired immunity lasts comes from measles, actually. So we know that measles immunity lasts until a baby is 6 months old. And we know that because when there were measles outbreaks, babies under 6 months never got sick or rarely got sick if their mothers had had measles and had immunity. And so that's why actually we start giving measles vaccine only to 6 months and up, and mostly to 1 year and up. All passively acquired antibodies that have come from mother to the baby through the placenta last somewhere between 6 and 9 months. And past that, they're not going to be protective. But there are two kinds of antibodies that are helping to protect your baby. One is that acquired through the placenta, which is called IgG antibody, and it is in your bloodstream. So where do you get COVID? You get it through respiratory secretions, right? So you don't get it in your bloodstream first, you get it in your nose first, right? Or your mucous membranes. And so the interesting thing is that babies acquire a second kind of immunity through the breast milk called IgA, or secretory antibodies against COVID. And those antibodies actually line the baby's intestinal tract and respiratory tract from breastfeeding. So even if you're only able to offer, some colostrum in the first days or a partial supply of breast milk, breastfeeding will help your baby also, as long as you continue to breastfeed some. So it's wise to try and breastfeed your baby if you have immunity to COVID through vaccination or through illness. Breastfeeding your baby can help keep them well.
And I think there have been some people wondering about breastfeeding. So it's helpful to hear the information about Dr. McConnell and Dr. Mazoon both saying that they're seeing antibodies come through. So here's several people have worried about this, and I've heard it from multiple pregnant people, and now we've got questions about it, and that is, if mom had COVID before pregnancy or during pregnancy, should she expect any complications during delivery, such as early delivery or complications or concerns about the health of the baby?
So I've had a lot of COVID positive pregnant patients. We've had patients that are just mildly sick, that had COVID before the pregnancy, didn't affect the pregnancy at all. That had COVID during the pregnancy, and we give them Lovenox for 2 weeks to decrease the risk of blood clots, because you're already at risk for blood clots in pregnancy. But and then the COVID seems to increase the risk of blood clots too. So we give you Lovenox for 2 weeks, and then we put you on a baby aspirin to decrease that risk of blood clots until you deliver. So that's something that we're doing as preventative for blood clots. Now, and then we monitor baby's growth. So every 4 months we do a check on baby's growth, making sure the baby's growing appropriately. And for the most part, we actually haven't seen a trend of babies growing smaller. This is just theoretical. That's what our high-risk MFM doctors, perinatologists recommend, that we just monitor the growth. And that's about all, the only extra thing that we do, in addition to the Lovenox and the baby aspirin. Now, if you get severe COVID, where you have pneumonia and you're hospitalized and you're intubated, then obviously, yes, there is the risk that you could go into preterm labor, you could develop preeclampsia. Actually, an article just came out recently that showed that they think that there may be a correlation with developing preeclampsia with COVID if it's severe and it's in the late pregnancy. But that's kind of preliminary data still. So so we do all these extra monitoring, and if you're a patient that has COVID and ends up hospitalized and needs oxygen, then that's an even bigger concern for baby's growth. But for the most part, if you recover well and baby continues to grow well throughout the pregnancy, there really isn't much more concern beyond that.
I'd agree with that. In addition to being an immunization person at Kelsey, I do newborn care at Women's Hospital for all of our babies that deliver there. And, we've had lots of babies delivered from moms who had COVID during pregnancy who are perfectly fine. There are viruses like chickenpox or cytomegalovirus that can cause serious, not only growth problems, but serious developmental problems in babies. But we've not seen that with COVID, and heaven knows we've had a lot of moms with COVID. I think if there were a syndrome that we're developing because of COVID, we would have found out by now, because so many moms have had COVID and have delivered babies, and there's nothing like Zika, with microcephaly, no problems with skin rashes, no problems with development that we can pick up. They really seem to be healthy babies as long as mother stays healthy enough to deliver them at term.
And ideally, mom has gotten vaccinated or is getting vaccinated.
Mm-hmm.
And I'd like to kind of say something based on that statement. So last year when the COVID pandemic first hit, we did see a lot of COVID positive moms, and there were a handful in our little area over here that did get severe, did end up in the ICU. But for the most part, they were mild symptoms. They were just like a common cold. This year, however, the COVID patients that we're seeing are having like allergy symptoms, and the ones that are vaccinated, it's kind of limited to that. That's about the extent of it. It's like allergy symptoms, congestion, runny nose, maybe a little bit of a cough. But the ones that aren't vaccinated, I'm seeing a very big difference with the Delta variant. With the Delta variant, I'm seeing pneumonia left and right. I've had a lot of patients I've sent home on oxygen because of it. So last year was like a completely different COVID than this year, and the vaccine is making a world of a difference, because the patients that are vaccinated aren't reacting that bad to the Delta, but it's the ones that are not vaccinated that are getting pneumonia, are ending up in the hospital, are ending up going home with oxygen, and those are the ones I'm really worried about.
And that's even young and healthy people looking at the county
with no medical
reports.
problems. I mean, very young, healthy people with no medical problems, which is surprising.
Yeah. So definitely important to take care. And speaking of taking care, this is one of our popular questions because it's something, people who are pregnant are preparing to bring home a new baby are very concerned about, and that is protecting the health of the baby. So what are your recommendations on unvaccinated family members and visits once baby is here? And what about newly vaccinated family members or recently recovered family members?
So in order to be considered protected, you need to be at least 2 weeks out from your second dose of vaccine, or at least 2 weeks out from your only dose of the J&J vaccine. So once someone is in that category, you can consider them safe around your baby. Other unvaccinated family members, you need to encourage them to get vaccinated. Babies can catch this illness. Babies can get sick and need to be hospitalized with it. They need to be vaccinated while you're pregnant to protect you as well. It's really important to understand that this is a family illness. It's going to be transmitted within the household. And I understand that can put some strain on people, because some people who have anti-vax kind of mentality are going to be very hard to convince. So encourage them to talk about it with their doctor, encourage them to come to webinars like this, encourage them to really think about your health more than their own health and to do it for you. Use whatever emotional leverage you have to get them to get vaccinated, because it's really important. And, you know, early on in this pandemic, before we had the vaccine, we had a lot of mothers delivering while they had COVID. And we initially were doing things to separate the baby from mom so baby wouldn't catch it, because we didn't know how babies were going to react to it. Now we're not doing that separation. If you deliver while you're positive with COVID, we will have you wear a mask and wash your hands before you breastfeed, but you will stay in the room with your baby. Your baby won't need to be in an incubator away from you in another area of the hospital or anything like that. But you will be in an area where everybody who comes in will have a face shield and a mask, a good quality mask, and be fully gowned to protect themselves. And really, you know, your household members are doing you a disservice if they're not willing to get vaccinated to protect your health and the health of your baby. And that sounds rather rude or abrupt, but it's really the way I feel about it.
I think it's honest is what it is. It's truth. I mean, we all take care of our family members and make decisions to ensure that we protect and take care of them. So I think it's important, especially right now, and especially for, you know, mom expecting a baby. Dr. McConnell, one of our questions that's come in is, you know, you were talking a little bit about immune system. What can pregnant moms do to bolster their immune system during pregnancy?
You can take your prenatal vitamins and you can get your vaccine. That's the only thing you can do, is get your vaccine.
That's good. Thank you.
I do want to add something to the previous
Oh, sure. Thank you.
So first, if you have COVID and your baby ends up in the NICU, that is a different scenario. They are not allowing COVID positive parents up in the NICU. That's very rare, but sometimes it happens. And so I just want to make you guys aware of that. And the second part is family members. So I get this question asked all the time when I see my postpartum patients. And I've had some patients so depressed over this issue. So I think that it's very important to have that cocooning conversation, just like with Tdap. You get vaccinated for Tdap, you ask your entire family to get vaccinated for Tdap, so that nobody gives your baby a whooping cough. Because whooping cough can be just like a regular cold and nobody knows that it's actually whooping cough, and whooping cough can kill babies. So you do the same thing with the COVID vaccine. You have to cocoon. And so that can be a way that you can introduce it to your family. The second part though is that as much as our family love us, and as much as we love our family, sometimes there's disagreements, and some people will be anti-vaxxers and they will refuse. And in those scenarios, I just encourage my patients to, if they're going to allow them to visit, to mask and sanitize or wash their hands thoroughly before touching the baby, and maybe limit that interaction. I don't want my patients to get depressed because their grandma won't get vaccinated and can't come see their baby. I do want you guys to see each other, and I do want there to be a bond, but I think that you can encourage the visitation with some limits, and those limits and boundaries are things you're going to have to learn to set for your family either way, having a new baby, whether there's the COVID pandemic or not. And so with the COVID pandemic, you're in your full right to ask them, if you're going to come see my baby and you're not going to get vaccinated, we're going to limit that time maybe to 15 minutes or whatever number you want to set. And you're going to have to wear a mask and you're going to have to wash your hands.
And just to follow up on that, because I think that's wonderful advice and important to think about emotional health as well as physical. Would it be safer in those cases, now that the weather is starting to cool off a little bit, to maybe have that outdoors, or is indoors, outdoors, same difference? What would you recommend?
I would agree with outdoors might be a little bit better.
Okay, thank you.
And I would
Um,
say, and on top of that, that it really was good advice and much more compassionate than mine. I think that if it is a member of your actual household that is not vaccinated, you can still apply some of those same rules. Please wear a mask when you hold the baby and wash your hands before you hold the baby. And if you're not masked, please stay at least 3 feet, if not 6 feet away from the baby until you put your mask on. I think that that will help reinforce not only the safety of the baby, but the importance that you feel of protecting your baby from this illness.
so this was one question that came in, and I don't know how many people wonder this, but I have noticed these two terms being used interchangeably, but it should be a quick and easy one, Dr. Mazoon. What is the difference, or is there a difference between a booster and a third dose?
There definitely is a difference. So a
Mhm.
third dose, when kids get their vaccines, they get a whole bunch of doses like 2, 4, and 6 months, and then they get their boosters at like 18 months. So when you get a bunch of doses in a row, that's called a primary series. And many of our vaccines require a primary series. The DTP is just one of them. Polio is another one. So the COVID vaccine was thought to require only a primary series of 2 doses. But now we know in people who are on cancer chemotherapy or on high-dose steroids by mouth or on any number of medications that can affect their immune system, 2 doses is not enough to protect them. It only protects about 50% of people in that category. And a third dose will increase the number of people protected to about 75% of people in that category. So they're being asked to get a third dose of a primary series. So they don't have to wait any longer than a month between dose 2 and dose 3. And yes, they will need a booster 6 months out from dose 3. Okay? Because their immune systems are not as adept at responding and making enough antibodies. A booster is always given after a span of time. And what a booster is doing is making sort of a short-lived immunity more longer-lived and more robust. So the reason we give booster vaccines of any vaccine is really to kind of wake the immune system back up to that that antigen, that protein that we need to develop our resistance to, so that it will be last a longer time. So a child who gets their primary series of DPT, for example, if they're not boosted at 18 months, they could get those illnesses. But if you boost them at 18 months, they don't need another shot for 4 years or 3 years. And then they only need it every 10 years. You get your tetanus booster every 10 years. And that's because that boosting has made the immunity more long-lived. And so a booster actually needs to be separated at least by 6 months, and in some vaccines longer than that, in order to really make your immunity more long-lived.
Great, thank you. I know that was a good question because I think it's something that gets mixed up sometimes in how it's reported. Dr. McConnell, going back a little bit to support system, this is a good question from a birth doula. One of her clients asked, if mom comes in to deliver and tests positive for COVID, and maybe you can speak to a little bit about, when you're in labor and you come into the hospital, what should you expect a little bit with that? And has been admitted and has started the birth process, but is COVID positive. What happens with her birth partner being there? Does that affect her support system during labor and delivery?
So when we have a COVID positive patient in labor, she still gets her one support person. She just has to wear a mask. So it
And
doesn't
are they
change.
testing both when they come in?
No, they don't test. They only test the patient, and the spouse only needs to report. He needs to report if he's positive. But for the most part, spouses don't get tested unless the baby goes to the NICU. If the baby goes to the NICU, then we have to have a negative test for whoever is going to visit the baby. So if the spouse is positive, the spouse can't go. So then the family has to designate someone, a caretaker, whether it be a grandparent or an aunt or a friend, that can go and visit the baby while the parents aren't able to go to the NICU. And we have to remember that though that sounds horrible, there are lots of very sick babies in the NICU. NICU stands for Neonatal Intensive Care Unit. And so these are babies that are struggling. And so if we were to introduce the COVID virus into that unit, we would be really compromising a lot of babies. And so since we have gotten into these situations where neither parent could visit the baby, we've set up like iPads so that the parents can see the baby through, little FaceTime chats or videos. And then we have a family or friend going and bond with the baby so that the baby doesn't feel alone. And of course, the nurses are wonderful and they always go and they love on all of those NICU babies.
It's special people in there for sure.
And if you are separated from your baby, it's really important that you start pumping really early after delivery, even in the first hour if you can, certainly by 6 hours of life, and that you pump around the clock every 3 hours. And really a skill that all of you can learn is called hand expression. There's a good video called at firstdroplets.com on how to do hand expression. Hand expression of your milk is actually more effective than the pump in the first few days because the colostrum is very thick and it just doesn't come out very well with a pump. Firstdroplets.com is a great website to kind of prepare for your delivery and to know what to expect. And it has a video on feeding preemie babies and a video on feeding term babies.
And we also have a really good breastfeeding basics series that we offer through Kelsey webinars. So if any of you are interested in that, it's a really good thing to check out. So Dr. Mazoon, we're kind of back a little bit to the spread, and I love that people are asking this because it indicates they're concerned about it and interested to learn. So this is about spreading the virus, and the questions revolve around vaccinated people and the risk of spreading, people who've had COVID and might get it again, and how long might your immunity last? So if you can address that just to help our audience a bit briefly here.
Sure. So we really did not know until the last few months that whether the vaccines could eliminate nasal carriage. There are many vaccines that we give that actually can eliminate germs from your nasal passages because of that IgA antibody I talked about earlier. And it was hoped that the COVID vaccine would do that as well. And in fact, it probably does eliminate the original COVID virus pretty well from your nasal passages, but these variations of the virus are just not quite as, the antibodies that we produce are not as sticky to their spike proteins, and they are just more infectious. And so if you think about it this way, if somebody with COVID sneezes in your face and you breathe it in, it's going to be in your nose for a little while before your immune system can clear it. So what we know about this Delta variant is that people who've been vaccinated can be asymptomatic carriers. It doesn't necessarily mean that the virus actually infected them to any large degree. It may only be in their nose for a short period of time. It may be there for a few days because some of the virus is reproducing in their nose, but doesn't get down into their lungs because of the IgG antibody and some of the other, more robust immune responses we have down in our lungs. So vaccinated people can spread this to other people. That's why we are really, they do it less than people who are unvaccinated. And people who have had COVID also are likely to get the Delta variant, but have less spread from the Delta variant to unvaccinated people because they do have some immunity, kind of like one shot, as has been mentioned. So, the people at the biggest risk for spreading this to others are people who are totally not vaccinated, which would include all children under 12, many children 12 to 18 who haven't been vaccinated yet, and many 18 and up who've not been vaccinated yet. So we still have a large population of people spreading it. The amount of spread that they are producing compared to those that are vaccinated are producing is, it's not even comparable. So most of the spread is from unvaccinated people, but theoretically the spread is possible from vaccinated people as well.
Thank you. And a follow-up to that, this person is curious about getting the vaccine 4 weeks after having COVID. So for clarification, is that 4 weeks from onset of symptoms or 4 weeks after you test negative?
So you can actually get vaccinated as soon as you test negative. When you produce your own, I'm sorry, dog in the background. When you produce your own immunity, those antibodies are around in your system, and getting the shot is just going to make your body produce even more antibodies. The idea of spacing is to make it more like you're getting 2 doses of the vaccine. So sort of to ramp it up a little bit later and extend the period of time at which your body is producing antibodies. And when you get antibodies through an infusion to treat COVID, those last in your system for 3 months. And so that's why you can't be vaccinated again, because somebody else's antibodies are going to make the vaccine less protective. But the vaccine, it doesn't do that with your own antibodies because your immune system is already producing those antibodies. So it's kind of a confusing situation, but
Right.
but you can get vaccinated earlier than 4 weeks. 4 weeks is probably a good spacing to just sort of take, the curve of your antibody production is starting to go down and it'll boost it back up. Not like a booster, I shouldn't have used that word perhaps, but it'll increase it again. But you can do it as soon as you are not contagious. You can get vaccinated as soon as you're not contagious.
Thank you
Some
so much for
people
clarifying.
actually, at one point in this whole, when vaccines were in short supply, at one point we were asking people who had had COVID to wait the 90 days so that the vaccine supply would be available for people who had no immunity. But we're not asking them to wait anymore.
Great, thank you. And this is, I think, a question we can't answer often enough because there's so much myth out there and so much misunderstanding. This person is curious, should parents worry about what the vaccine might do to their unborn children, such as side effects later on in life from the vaccine? And if both doctors could address that, I'd appreciate it.
I'll let Dr. McConnell go first and then I'll
Okay.
answer.
So based on what we know of how the vaccine was made, we're not injecting the virus into you, and it doesn't get put into your DNA, so it doesn't get transferred over into baby, and it doesn't mess up the baby's DNA. Along that same line of thought, there's no, it doesn't affect your fertility on men or woman. It has no effect whatsoever, just like the flu vaccine doesn't have any effect on either of those things. And so based on how we know the vaccine was made, and that it doesn't even stick in your bloodstream for long. It gets injected here, it creates the antibodies, and then the injection that we put in originally, it dissolves. A little vector that is the protein that creates that, it disappears. It's not in your body. And so we don't think that there's any long-term sequela.
You know, we have studied vaccines in pregnancy and illnesses in pregnancy for a long time. And, you know, it's funny, nobody ever brings up, well, you know, if I have strep throat during pregnancy, is that going to damage my child? Is that, you know, there are a lot of things that we fight off all the time when we're pregnant that don't damage our child. There are actually very few viruses that we know are harmful to children. And we actually have not been very successful at creating vaccines against those. Cytomegalovirus is a far worse virus for your baby to get than many other viruses or vaccines. And so, and we don't have a vaccine against that. So this vaccine, as Dr. McConnell said, only stays in your system a short period of time. And we know from all the research that's been done on vaccines for well over a century now, that really most vaccine side effects are going to occur in the first few days. And even the delayed effects that we've never had a delayed effect that was more than 6 weeks from a vaccine. And we've never had a vaccine, even those that are potentially dangerous to the baby, we've never really had a problem with those. So we know that, for example, measles, we know that rubella can cause serious problems in infants. And that's why we give you and check your titers for rubella when you're pregnant. You know, that's why we give you vaccines, because rubella can cause cataracts and mental retardation and autism and all kinds of problems in newborns. And we worry about the live virus MMR vaccine because it is live rubella, but it's been treated so that it can't cause much of an infection. And even that vaccine does not cause any of the problems that full-blown rubella causes in newborns. It's occasionally inadvertently given to someone who didn't know they were pregnant. Those women are followed and the babies are fine. So we really don't have any vaccines in our long history of making vaccines that cause problems with babies. So,
and to be clear, because this is something that is one of the common myths I see going around. And we're getting down to the last 5 minutes. We still have a few questions, so if people don't mind going a couple of minutes over, but at this point, I'm going to go ahead and close to additional questions. But this is something I want people to understand, and that is surfing the vaccine adverse event reporting system and thinking that things that are, you know, in there are proved, but they're not. That's simply a report that has yet to be investigated. So it is not a causation report. It is simply someone reporting something, and it could be erroneous or not related or something like that. Dr. Mazoon, is there anything you'd like to clarify further on that?
yeah, for sure. So it is an event, it's a database where anybody can report. So often there are duplicate reports if somebody had some adverse event after a vaccine. So there's no denominator. You don't know how many vaccines were given to have this many reported deaths, for example. And some things are mandated to be reported even if you don't know that they're related to the vaccine, death being one of those things. So there are a number of deaths reported, and that scares people. But the truth of the matter is, we started giving this vaccine to people who were 75 and up. And people who are 75 and up die. And so that death has got to be reported whether or not we think it's due to the vaccine. So, you know, people took that totally out of context and said, oh, well, this vaccine causes people to die. And in fact, the death rate among people who don't get the COVID vaccine is much higher than the death rate of people who do get the COVID vaccine. And each death is reported so that it can be investigated to make sure it wasn't due to the vaccine. So the nice thing about VAERS is that it can help us pick up exceedingly rare events. So it is because of VAERS that we know that sometimes blood clots can occur after the J&J vaccine. It's because of VAERS that we know that sometimes like 1 in a million people who receive the vaccine might have Guillain-Barré syndrome. So I want you to kind of think about that. We have about 330 million people in the United States. If every one of them got the J&J vaccine, that would be 330 people with Guillain-Barré syndrome, max. If every one of them does not get the vaccine, what happens? We've already had 680 something thousand deaths from this virus versus a possible 330 that might get that side effect. So those reports, I think, scare people, but they're not looking at the big picture. The big picture is this vaccine is very safe. It's very effective, and you are at much higher risk by not being vaccinated than by taking the vaccine. Sure, you can go in and worry and go, oh gosh, is it going to hurt? Am I going to have a fever? Could I be one of those rare people who gets one of these bad syndromes? Yes, you could, but the chances are you're going to get struck by lightning on the way to your car or have a car accident on the way home. Those are much higher risks to you than that the vaccine is going to cause a bad effect to you.
And
or
the risk of being ill is much higher.
Much more. Yes, huge.
Right. So speaking of being ill, Dr. McConnell, every time we have one of these webinars, we get this question, and I appreciate so much when people ask it, and that is about getting the COVID vaccine and the flu shot. I know that expecting parents are especially concerned about this. So what is your advice about COVID vaccine and flu shot during pregnancy? Maybe getting both of them during pregnancy.
I want you to get both of them as soon as you can get both of them, and you can get them together. We're doing that.
You can get the Tdap. You can get all three of them on the same day.
Yeah, sometimes we do that. Yeah.
So do please get that. So another question came in about maternal COVID-19, an indication for cesarean delivery. Is there any correlation between what you suggest for delivery in mom and having COVID?
Absolutely not. If you have COVID, we're still going to try to have vaginal delivery. There's no reason to risk your uterus, your internal organs for a C-section. There's no indication. So we still follow the same guidelines for offering a C-section based on if baby's in distress, if you're in distress, if baby's breech and we can't turn the baby. But COVID is not a reason to have a C-section.
Great, thank you. Okay, so we are at the end of the time. We appreciate everyone so much for coming. Dr. Mazoon, Dr. McConnell, thank you so much for your time and answering all of these questions. For those of you who still have questions, come visit us on Facebook, pose your questions, let us know what topics interest you, and we'll try to get that up for you next time.
Thank you.
Thank you.
Thank you.
Yes, thank you so much, doctors. If you don't have anything else to add, I would like to remind everyone, we actually do have a breastfeeding class tomorrow, and you can still sign up for it on Kelsey-Seybold.com. Thank you so much. This series is going to continue as our life in COVID continues, so please look out for that. Julie, thank you so much. Doctors McConnell and Mazoon, thank you again.
Thank you. Good night, everyone.